So today we're going to talk about the specific diagnostic criteria that delineate bipolar disorder from other psychiatric disorders or personality disorders. And we're going to do that right now. Bipolar disorder is often overdiagnosed. Lots of things that look like mood swings automatically get diagnosed as bipolar disorder, and they are not. There is one specific criteria you have to meet in order to have the diagnosis medically of bipolar disorder, and that is a manic episode. And we're going to talk about specifically what a manic episode is in just a minute. First, let me explain. There are two different types of bipolar disorder, bipolar 1 and bipolar 2. Bipolar 1, with episodes of mania and episodes of depression, is the one we're going to focus on today. Technically, bipolar 2 is a mood disorder in which the person experiences depression but doesn't quite experience enough symptoms to meet criteria, is what we call it, for a manic episode. So you can see in that the manic episodes remain in a state we call hypomanic, slightly below full mania. Today we're going to focus on bipolar 1, which is sort of classically what people think of as bipolar disorder. So in order to have a diagnosis of bipolar disorder, the person must have at least one episode of mania in their lifetime. The clinical reason that we focus on the manic episode rather than the depressive episode when looking at bipolar disorder is because the vast majority of people who experience a full-blown manic episode will also experience depression at some point. So the differentiation seems to be around the presence of mania. So what is mania? How do we define a manic episode? As psychiatrists, we use something called the DSM, which is the Diagnostic and Statistical Manual. It's been updated many times, and the most current one is called the DSM-5-TR, or text revision. According to the DSM-5-TR, the following criteria have to be met in order to have a manic episode. The primary hallmark for mania is a persistently elevated mood, or a period of time in which the mood is persistently elevated or irritable, or it can be both. That period of time needs to last a minimum of 1 week, according to the DSM. More than that is typical. The mood change needs to occur most of every day, nearly every day, for that given period of time. And it should be circumscribed. In other words, in between the episode of mania or the episodes of depression, there are periods of normal mood. In addition, the person has to experience at least 3 of the following: increased energy and agitation, an inflated sense of self-esteem, which can actually evolve into grandiosity, a decreased need for sleep, rapid speech, or what we call pressured speech, which is when the words are coming out so fast they're almost incomprehensible, a development of something called flight of ideas, which is basically ideas coming out that are disconnected to one another and generally will make the person listening have a very difficult time understanding what it is exactly the person suffering from mania is trying to communicate or trying to say. An increase in goal-directed activities. Generally, this looks like starting this project, starting that project, starting another project without necessarily finishing anything. The projects or the activity that is started is very often unrealistic. So I'm going to write a novel, I'm going to build a house, I'm going to walk across country, very big things, not necessarily connected to actual expertise the person has. And finally, a tendency to get involved in activities that can have disastrous consequences. And we'll talk about that in just a moment. So you have to have this persistent elevated or irritable mood for a week, and then you have to have at least 3 of the things I just listed and which are listed here. So let's talk a little more about how this manifests clinically. So a person with a manic mood state may appear very jovial, very happy, too happy, even silly. To the person observing, it may be obvious or it may be a little bit subtle. You'll generally see an expansive mood, and sometimes it'll evolve into irritability and anger. Oftentimes there will be observable shifts in mood. So going from elevated and cheerful and happy and silly to irritable and angry and hostile in a matter of minutes or even seconds. Sometimes people will take on, as I said a minute ago, lots of different projects, and they will move a lot. So agitated and physically moving around a lot, having to do and do and do lots of different things, not necessarily in an organized or consistent or logical way. There is often a general sense that, I can do anything. I can recaulk the entire house. I can run a marathon. I can accomplish anything that I decide to accomplish. Sense of inflated self-esteem is common, feeling like I have more power, I am special, I am related to a famous person, I can run the country, I can run for office, I can, so a sense that I am very powerful and very big and very important. A grandiosity can occur. The grandiosity may evolve into a delusional or psychotic state, which is a disconnection from reality. So again, maybe I think I'm related to or in a relationship with a famous person. Maybe I think I have superpowers. Maybe I think that I am actually somebody else. The President of the United States, for example. There is often a decreased need for sleep. So insomnia in general leads to fatigue and exhaustion. With mania, there may be a decreased need for sleep or even not sleeping at all, but we're not tired and don't feel tired, and the energy level remains consistently very high. Speech may be rapid and pressured. The person may be singing or rhyming or acting silly and talking continuously, not allowing anyone to interrupt. They tend to talk without any sense of the other person's needs or how the other person is responding. So you will often see this very pressured long stream of words coming out that don't necessarily mean anything, but are meaningful to the person who is speaking them. Sometimes a person's thoughts will become so rapid and so full and so pressured that they will find it difficult to speak because they cannot put words to that level of thinking that's going on. Speech may be very theatrical, very dramatic, lots of moving around, using lots of puns, using rhymes and jokes, and that may escalate to the point of being so pressured and so rapid and so continuous that you cannot really understand what they're saying. If a person with mania is more in an irritable mood than an elevated mood, you may hear lots of complaints, of ranting, lots of hostile words, cursing, and that may actually escalate to aggressive behavior or violent behavior. Distractibility is very common, so oftentimes someone with mania will become quickly distracted by noises in the environment or sights or perhaps what the interviewer or the person they're speaking with is wearing or their hair. Sometimes the distractibility is so severe that communication breaks down and they are unable to complete a sentence. If mania is severe, there is an increase in certain types of activities, perhaps financial, political, sexual, that can lead to disastrous consequences. So a person might go on a spending spree or become uncharacteristically sexually active in an indiscriminate manner. They may end up having problems with the police. They may become so manic that they believe they don't need to wear clothes and they will go out into the street naked and get arrested. They may shoplift simply because they believe they don't need to pay because they're special and get into legal trouble for that. So because of the rapid thinking and elevated or irritable mood and the very poor judgment, that combination can lead to lots of negative outcomes. The result can be job loss, school failure, divorce, financial ruin, all kinds of things. So here's a list again of the main criteria associated with a manic episode. And remember, you have to have at least 3 of these criteria in order to get a diagnosis of a manic episode. Once a manic episode has been clearly diagnosed, then the likelihood of bipolar disorder is very, very high. Now, there's one caveat here, which is that there are many drugs, substances, illegal substances, and also legal substances that can create a situation in which a person looks to be manic, but they do not actually have a fundamental bipolar disorder. Some of those include amphetamines, cocaine, the ADHD medications, steroids, L-Dopa, and if there's a few others, but those are the main ones that can lead inadvertently to a manic state. The prevalence of bipolar disorder in the United States in a given year is about 1.5%, so that's not totally negligible. If you have a first-degree relative, a parent, a sibling who has bipolar disorder, your risk of bipolar disorder goes up about tenfold. The peak age of onset for bipolar disorder is 20 to 30 years. As I said, more than 90% of people who have had a manic episode will then have a depressive episode. Mania is usually, when it usually occurs just before the onset of a major depressive episode. The presence of mixed features, which means both elevated mood, euphoria, and irritability and anger, indicates a poorer prognosis. Those people tend to respond less well to mood stabilizing medications like lithium, and they tend to do less well in the long term. The lifetime risk of suicide for patients with bipolar disorder is about 20 to 30 times higher than the general population. So this is a very serious illness that needs to be correctly diagnosed and treated. The level of impaired function can be very severe. About 30% of people with bipolar disorder have severe functional impairment, and that means occupational, family functioning, social functioning. There are many people who have bipolar disorder who function very well and normally. A lot of this is dependent on the type of bipolar disorder, the severity, and the treatment that's obtained. There are 3 psychiatric disorders that are commonly comorbid, that means associated with bipolar disorder, and those are ADHD, anxiety disorders, and alcohol or substance use disorders. So when we see these things, we need also to be aware that bipolar disorder may be an underlying. So to summarize, in order to meet criteria for bipolar disorder specifically, a person has to have experienced at least one manic episode, and that's the thing to remember. Mania, which is clearly defined in the DSM-5-TR, requires a certain number of criteria to be met. So the fact that bipolar disorder is widely overdiagnosed and misdiagnosed mostly is due to the fact that people don't understand these criteria. For information on the criteria required to meet a diagnosis of major depressive episode or major depressive disorder, please see this video here. And for more information on mood disorders in general, please see my playlist on mood disorders. That's it for today. Thank you for watching, and please hit the subscribe and like button if you like this video, and I'll see you next time.